This video will discuss the side effect of mental health medications and how to heal yourself naturally. It's about time to take care of your health naturally. Hello and welcome. I'm your host, Ambassador Edward Prokopo, CEO and founder of Shiba's Holistic Health and Services. If today is your first time on this channel, we'll say you are absolutely welcome. On this channel, we discuss a lot of things, but predominantly we discuss about natural health. How can one take care of your own health naturally? Your health is your wealth. Your health is your power. Nobody is responsible for your health. Neither the government, neither the pharmaceutical drugs industries, food industries, doctors, health workers. They are not responsible for your health. They are only providing services for you. When it comes to your health, you have to be radical. You have to be realistic. You have to be technical. It is your health. It is your system. Everything folks tell you to take in your system. What happens if you get blocked in the system? Who do you turn to? Who do you hold responsible for that? This video will discuss the side effect of mental health medications and how to heal yourself naturally. You are welcome to subscribe to this channel. It's about time to take care of your health naturally.
Next on primary care, depression in black men. Many suffer in silence.
We are alone at the very time that we really need to be reaching out to others.
I'm your host, Dr. Lonnie Joe. Depression is one of the most common mental disorders in the United States and affects an estimated 17 million people each year. Black men are just as likely as anyone to have depression, but less likely to get help for it. Left untreated, depression can lead to chronic conditions like diabetes, high blood pressure, sexual dysfunction, substance abuse, and even death. According to the Centers for Disease Control, suicide is the third leading cause of death for African American males aged 15 through 24. Black men can no longer live in silence and in the shadows of this treatable condition. Here to shed more light on this topic is Dr. Harold Woody Neighbors. Dr. Neighbors is a CS Mott endowed professor of public health at the Michigan State University College of Human Medicine. His research focuses on developing community-based programs that improve the health of black men. Dr. Neighbors, welcome to the program. Thank you for joining us, Woody. Excellent. Black men seem to suffer disproportionately from the disease. Black men. Why?
Well, I have to say that we, more than any other group, are not getting the help that we need.
So the
and not
results of
getting
it
the help
stands
that
out.
we deserve.
Good point.
I think the question that comes up is why won't black men seek help? And it's not just for depression, it's for some of the other conditions that you mentioned, diabetes, hypertension. We have a problem in reaching out to get the help that we need.
Woody, in the African American community, the church plays a big role. The spiritual lives of people has always been a big role, but in the African American community, it's different and it's special. I ask patients all the time, where you go to church, they identify with a church, even if they haven't been in a very long time. They identify with a minister. When it comes to this disease state of depression, where does the role of the church come in, the role of the pastor, this interaction with black men? What role does that play, and where does it come in with African American men?
So the general answer to your question is yes. The black church plays a very important role. When we ask people, what do you do when you're under serious stress, one of the top things they talked about was prayer. But the problem is that we as men are probably not revealing our stress to our church members, to our family and friends at the level that we should.
That's very true, because we see so many people in the family come along and say, I didn't know he had this problem.
Yeah, I mean, when you say something like that, it reminds me of Don Cornelius.
Yes, Soul
I mean,
Train.
everybody watched Soul Train all the time. Don committed suicide, unfortunately. His own son said those very words. I did not know my father was in such pain. Part of the reason he did not know, my speculation, is that Don Cornelius didn't really reveal the pain that he's in. So,
but there's also treatment.
Yes.
Medical treatment, treatments of other sorts, different approaches that help people deal with and overcome their depression. Will you speak to that?
Well, this is where it can get kind of interesting. One of the things I guess I'd like to let folks know is when you get to the point where you're feeling like, whatever's going on with me, it's pretty extreme, I need to get a professional's opinion. I would encourage people that if they can afford it, to get more than one opinion. Because a lot of the times the treatment you get is going to depend on to whom you're asking. So if you end up going to your primary care physician for assistance, I think you're going to be more likely to receive medication for your symptoms. And medication for many of these symptoms helps. But let's say you went to a psychologist or a social worker, they're not really, they don't have the ability to write a prescription. They may advocate more of a talking therapy. Now, my opinion is that the combination of both is probably the way to go. So those options are out there for folks. I think a lot of us aren't aware that the kind of help you might get depends on who you ask.
Very good point, especially in the senior citizen age groups and populations. They suffer most from desocialization than anybody in our society.
Yes.
So you take an elderly black man who's in this situation with an issue, he's going to suffer even more.
Yeah.
I think that's an excellent point.
Yeah, I mean, one thing we should all be against is loneliness.
Absolutely.
Yeah.
Yeah, people help people.
Right, but no man, and especially no black man, should be expected to be able to handle every problem that life is going to throw at you. That's just unreasonable.
Psychiatric drugs, that when you start taking one drug, it doesn't take long before you're on a second drug and a third drug, because side effects of the first drugs are often interpreted as if they were new diseases. So if you start with an antidepressant drug, you can become psychotic, and then you get an antipsychotic drug. And it's the same with ADHD drugs. They have side effects that are very similar to the symptoms you use when you diagnose bipolar. So some famous psychiatrists from Harvard, they have diagnosed bipolar in around 1/4 of the children where they started to diagnose ADHD. Then in 1/4 of them, they went on to diagnose bipolar. So they convert side effects into a new psychiatric disorder, which most of these children don't have. This is terribly, terribly tragic. And to treat children or depressed adults with antipsychotic drugs, in my view, is very, very wrong, because antipsychotic drugs are among the most toxic chemicals ever invented, apart from cancer chemotherapy. But if you have cancer, it's serious, and it can kill you. So you're willing to run a considerable risk. But antipsychotic drugs are very bad drugs. Actually, the newer antipsychotic drugs like Abilify and olanzapine, Zyprexa, and what they all called Risperdal and so on, in the registration applications submitted to the FDA in the United States, the benefit was so small that it was far below the minimum change that anybody can notice as a benefit. So actually the FDA has approved drugs that don't work.
Also, there are the side effects of antidepressants, which are numerous. Some of the most prevalent ones include nausea, increased appetite and weight gain, loss of sexual desire and other sexual problems such as erectile dysfunction and decreased orgasm, fatigue and drowsiness, insomnia, dry mouth, blurred vision, and constipation.
For starters, therapists are supposed to diagnose everyone. I was a therapist in New York State, a licensed clinical social worker with my R letter, meaning I had 6 years of supervision, which allowed me to have the highest level of billing to insurance companies. Now, social workers in New York have to diagnose everybody. They have to diagnose every client they see in therapy. And diagnosing people is incredibly stigmatizing. It can really actually cause people a lot of harm. And when you're in a field where you don't want to do any harm, why do you want to do something that's an intrinsic part of the field that actually so often harms people? Also, these diagnostic categories are quite arbitrary. Basically, you can stick most people in any number of these categories at any given time. So really what that does is that gives the therapist a lot of power to label someone with something that really doesn't have a lot of meaning. But that's just one thing that I found ridiculous. Another thing is this whole thing about medication, psychiatric drugs. We're supposed to push people, therapists are supposed to push people into taking psychiatric drugs. For if you have this problem, you're supposed to take this drug. This problem, you're supposed to take this drug. Oh, you have sleep problems, you can take this drug. And oh, you have this kind of mood problem or this kind of mood problem, well, you're supposed to take this drug or this drug. And if you have a side effect of this drug, you're supposed to take this drug. And it becomes really ridiculous, especially when you consider how unhelpful and downright dangerous so many of these drugs are and how difficult it is to get off these drugs. Therapists, we were supposed to, according to our education, get people to go to psychiatrists. We're supposed to up-talk medication, like, you know, how waiters, to make more money, they up-talk selling alcohol because that's how they make a lot of money. Well, therapists are supposed to up-talk medication, and they never get in trouble when you up-talk medication. And it sounds very scientific, and so many people buy into it. But the truth is, what really was our education in terms of medication as social workers, as psychologists? It's ridiculous. It's the opposite. What about when people want to come off medication? Because lots of clients really do want to taper down off their medication or just stop them entirely. So how do therapists help them? Well, what we're told is, oh, no, that's not within your area of competency. Don't even talk about that. That's very risky. You can get in a lot of trouble for that. What I found also is that a lot of my friends who are not therapists at all actually had a lot more common sense. I think the mental health system burned the common sense out of people. It ripped it away from them, and it made people have a lot less common sense. I've also seen that with some people.
My name is Peter Gurja. I'm a director of the Nordic Cochrane Center in Copenhagen and professor of research design and analysis at the University of Copenhagen. 2 years ago, I found out that our prescription drugs are the third leading cause of death after heart disease and cancer. Our drugs kill around 200,000 people in America every year. And half of these people die while they do what their doctors told them. So they die because of the side effects. The other half die because of errors. And it's often the doctors that make the errors because any drug may come with 20, 30, or 40 warnings, contraindications, precautions, and so on. No doctor in the world knows about all this. So the other thing I found out 2 years ago was that much of what the drug industry does fulfills the criteria for organized crime in US law. And they behave in many ways like the mafia does. They corrupt everyone they can corrupt. They have bought every type of person, even including ministers of health in some countries. The drug industry buys the professors first, then chiefs of department, then other chief physicians and so on. They don't buy junior doctors. So a lot of other drugs and antidepressants also make people fall and kill them. And they may affect your cognition, your memory, and all these things. And then they interact in ways that we know almost nothing about. Very many elderly, they take more than 5 drugs a day. And we actually don't know how these drugs interact with each other. So these psychiatric drugs, some of them may have a beneficial effect in the short term, but they are definitely harmful in the long term, and probably all of them cause permanent brain damage. And also here, the psychiatrists, they use myths because they tell the patients that depression and schizophrenia destroys your brain, so now we will get a drug for you that will prevent this brain damage. I have seen these studies. It has never been documented that the disease leads to brain damage, but it has been documented that the drugs cause brain damage. So it's wrong. That may be beneficial in acute situations, but people become dependent on them, just like on street drugs, so they have difficulty getting off them. So therefore, in the long run, the way these drugs are used today cause more harm than good. So it would be better for us if the drugs didn't exist, because doctors can't handle them. Now it's more chronic, and what they don't realize is they created this with their drugs.
One question that often comes to mind when thinking about cannabis usage is, how does frequent marijuana use increase the development of mental disorders, such as psychosis, schizophrenia, depression, and bipolar disorder? And is there even a link between cannabis and these mental health illnesses? Maternal cannabis use, or using cannabis while pregnant, may also contribute to psychosis in the child during later stages of their life. That cannabis causes anxiety.
America has a problem, and we need to see a doctor. So we're very fortunate today to have an appointment with the nation's doctor, Dr. Vivek Murthy. Welcome.
Thank you so much, Sean. It's good to be here.
An ominous title hanging over us today, mental health crisis. And as we sit here now entering into the 3rd year of the pandemic, what we've seen quite often is disruption in routines, social isolation, economic distress, political unrest, civil unrest, and we need to do some things about it. So how do you look at the national mental health crisis? What do you feel are the most significant indicators and the most worrisome indicators of America's national mental health crisis?
Rates of anxiety and depression. We know that loneliness and isolation is a profound challenge in the United States and around the world. Even though we don't talk about it as much, it is there, and the numbers are staggering. There are more people who, for example, in the United States, who struggle with loneliness, more adults than adults who have diabetes in the country. But think about how often we talk about that, and the health consequences of issues like loneliness are profound. Even though about 50% of CEOs, for example, struggle with loneliness and feeling like they're on their own by themselves, which is incredibly stressful, it's not something we talk about often in C-suites or in boardrooms. So we have to overcome that stigma. We struggle with loneliness. We're also at increased risk of anxiety and depression, but also dementia, cardiovascular disease, premature death, sleep disturbances, impaired wound healing. The list goes on, because
the medication also has to connect with the communication, be different. We need new medications. We haven't seen much advance in anxiety and depression disorder medications for decades.
I heard about this on that side from, this is going to me, but this is the first time I'm hearing about the consequences of it. And there's always these, written panels about, okay, just fill out your name here and we'll fill out the rest in our communities.
For giving us your attention, engaging with us, asking the questions that you did.
It's about time to take care of your health naturally.
Our Liberian people, we choose success. Our Liberian people, we choose success. people, we choose success. Wherever you play, wherever you go,